this is the largest European conference we've ever held in periodontology, and it's really attracted people largely from Europe, but from across the world, and particularly Asia and South America. And so it shows just how important we feel this is as a subject and how attractive it is to dentists and periodontists throughout the world. We've probably got in excess of 7,000 practicing clinicians and scientists who devote themselves to this particular topic.
And now you have the word.
Brief more questions, please.
There are microphones available.
If you want to ask in German, you can also ask in German, it's no problem.
Also in Spanish.
In Dutch.
And Austrian.
Yes, please.
Hello, my name is Tobias Bauer from Dental Germany. One question. I've been visiting the Europerio since Berlin in 2003, sorry. But my impression is that it becomes more and more an implantology event. What do you think about this impression?
I'd like to answer that question first of all. Well, in this particular case, this conference, we've actually reduced the amount of implant dentistry. We feel there's only, probably in the main program, 1/3 in implant dentistry. And so we're trying to redress the balance to some degree. But I think what you have to remember also is that implant dentistry is a very important part of dentistry, and that periodontology and periodontal research has contributed hugely to our understanding of how implants work and the complications that also occur with implants. So it is an integral part of periodontology as well. In addition to that, as you know, some of the major industry players are in implant dentistry, and they're also valued partners of us in this congress. But I'd like to think that it is not growing in terms of its impact and size within this congress, but it still remains actually a very important part. Does that help you?
Yes, sure, thank you.
Hello, Claudia Jan from Ernst & Young. You all agree that it is important to raise the awareness of periodontal diseases. Can you name ways to raise the awareness for this special disease? And do you think Europerio is one way to make sure that periodontal diseases are addressed?
I think probably one of the most effective ways you'll find actually our industry partners, the toothpaste manufacturers, the mouthwash manufacturers, have made a tremendous impact in making people's awareness of periodontal health. And nowadays many people know about gingivitis and plaque and gum disease. So I think we've got a lot to thank them for in terms of publicising the disease and the treatment of the disease. And we are here obviously to treat those people perhaps who are more susceptible to disease, where some of these simple over-the-counter treatments are not quite so effective.
And maybe I can add to it that the awareness at the moment that any inflammatory disease may have systemic effects, may reduce your normal well-being, including periodontitis as an inflammatory disease, makes also the total medical profession very aware of the importance of the oral cavity. It is unfortunate that regular physicians hardly look into the mouth, don't know anything about it. I think somebody who will study, who becomes a doctor, has 2 hours of lecture in his whole curriculum. So, but the awareness now that any inflammation, including the oral cavity, the periodontal inflammation, has ramifications for overall health, cardiovascular disease, the diabetes, even recently erectile problems, cancer. So it is important, and through the medical profession we will get also more attention for this disease.
Thank you.
Just a follow-up question. I heard your words, and that was the same impression I got during the last months, that nearly every disease was linked to periodontology. It was erectile problems, diabetes, it was coronary problems, Alzheimer. Everything now is linked to perio. Isn't, for me, it's just, I'm asking myself, isn't it an overestimation of that case?
Let me answer that. You mentioned in your words is linked. That is, most of it is proposed to be linked. These are exploratory studies where in the periodontal arena we follow other inflammatory diseases like rheumatoid arthritis. And we also investigate whether this type of inflammatory disease follows the same direction as other inflammatory diseases. And you have to realize that for now we have several proven associations. For cardiovascular disease it's proven, for diabetes it's proven. But the association itself doesn't mean there is a causation. And that is the next step. So many researchers here in this Congress are reporting on their efforts to dissect whether or not this association is truly by causative reasons rather than coincidental reasons. And I mentioned just now in my statement that we find a common gene variant. So it could be that periodontitis and cardiovascular disease are not causative related, or periodontitis is not causative related, but share common pathways. So that is the next step. We have identified the proven associations with meta-analyses, so many studies together, and then next step is to dissect causative or reasons why. I hope that answers your. Maybe you want to add something to it, Bert?
A very good example for that is the association between preterm birth or preterm birth outcomes, adverse pregnancy outcomes. You know, this was a very great debate. It's a problem, an association between periodontitis and adverse pregnancy outcomes. The first paper was in the late 90s from America. They showed that there is an influence that patients with periodontitis has babies with preterm birth and less birth weights, but there was a huge strength to find out if the treatment maybe would reduce this risk. And there was a huge effort, and they spent a lot of money with huge trials over the world. They couldn't show that, which some trials showed that maybe a reduction of this risk could be. But as a conclusion, we can say now that at specific susceptible patient there is maybe an association that patients with periodontitis have a risk to get adverse pregnancy outcomes, and that is maybe the same underlines as with cardiovascular diseases, common shared risk factors which maybe trigger the bacterial burden as well as the inflammatory mediators maybe can trigger these other things. Can you follow?
Sure.
Thank you.
Hello, I'm Anita Rutke from the EDI journal. I have a question on periodontitis and peri-implantitis. Do you think it should be treated the same way? Is it the same bacteria? Should it be treated the same way?
That's a very difficult question, and there are lots of presentations here in these next few days on that particular topic. First thing is it the same disease? It can't be the same disease. They share, they're an inflammatory disease, and both are associated with loss of bone. But as we know that probably the periodontitis is a little bit more complex than that, because you've got to also lose the attachment to the tooth surface, the collagen into the cementing, so it's a little bit more complex in that respect. So they're both inflammatory diseases. They both have a heavy burden of bacteria, and the ecology of the two diseases, if you look at a pocket around a tooth and a pocket around an implant, are incredibly similar. And the biofilms are incredibly similar because they almost have to be, they're bound to be. And so in that respect, the treatment at the moment will remain the same because it will be to reduce the causative agent, which we believe is the bacterial biofilm, and to reduce the inflammation and thereby reverse inflammatory changes. And in that respect, we are, I think, limited by the same therapies. Right? Nobody's going to come up with a new therapy, I don't think, for periimplantitis that has not been tried in periodontitis. Yeah?
Maybe we can add, this morning was a very nice presentation on the microbiology of periodontitis and peri-implantitis, with the next generation of sequencing of the total microflora, microbiota, we call it the microbiome. And with this new generation of sequencing, looking at the complete total microflora, there seems to be a clustering of bacteria and species in the peri-implantitis versus the periodontitis being different, and